officials are now expressing concerns about the surge in RSV infections in children across the United States. And what's causing this surge? Well, here to discuss this issue further is Dr. Charlotte Boney, pediatrician-in-chief at Bay State Children's Hospital. Doctor, how are you doing today?
Great to be here. Thank you.
So why are the RSV infections rampant across the country, and are the infections higher in our area?
So great question. If you had asked me this a few years ago, pre-pandemic, RSV and other respiratory viruses typically surge in the wintertime. So they start to rise in late fall, they peak in January or so, they go away in the spring. But since the COVID-19 pandemic, we've seen something very different. Basically, the seasonal variation is turned upside down. So after the first winter of COVID-19, so that would be 20 into 21, we didn't see any RSV or other serious respiratory viruses in our hospital or to much degree in our emergency rooms that entire winter. And then in the summer, RSV came back. We saw a little bit of a peak last summer, again, unusual. It went away in the fall when Omicron, the variant of COVID-19, really hit kids really hard last winter. And then RSV and other respiratory viruses really started rising again early in the summer. The other respiratory viruses like rhinovirus and enterovirus have been surging like crazy in the last 6 to 8 weeks. We've seen a lot of kids admitted to our hospital and our intensive care unit. And now we're beginning to see RSV rise quickly. Again, very unusual for this time of year.
So since it's risen so much, are there ways that it can be prevented? Can you prevent RSV?
So RSV causes in most of us a common cold. But if young infants and young children with underlying health conditions like lung problems, heart problems, asthma, when they get infected with RSV, it can cause quite serious respiratory illness, what we call bronchiolitis or actually real pneumonia. We've always seen this in young children with RSV in the winter. In fact, pre-pandemic, about 50,000 children a year got hospitalized because of respiratory disease, mostly from RSV. So it's not the winter yet, it's only the late fall. And we think that these RSV and other respiratory viruses are surging because they haven't been around for a few years, right? We've all been masking and following all those other infection control measures. Those measures were good at preventing COVID-19. They're also good at preventing other respiratory viral infections. And now here we are. Those measures have been relaxed and these viruses are surging. And it's really scary. Our emergency departments are full, pediatricians' hospitals are full, and hospitals all over the country, children's hospitals, are full with these respiratory viruses. So what can you do? You can go back to many of those infection control strategies. Wash your hands like crazy. This is a contact virus. Don't go to school, work, sports if you have respiratory symptoms. I've heard people say, well, it's not COVID, so I'm going to go to school. Well, then you're just spreading this virus around.
Okay, and real quickly, doctor, what are the treatments for RSV?
So really the treatments for RSV are symptomatic if you develop respiratory disease severe enough to come into the hospital. That's oxygen and some other supportive measures just to get you through those symptoms until the virus starts to fade.
All right, Dr. Boney, thank you so much for joining us. It's all the time that we have, but thank you. We appreciate it.
Get your flu and COVID vaccines, please.
Thank you, doctor.
Okay. Thank you.